So how is it determined if a patient is able to qualify for coverage under these state-based programs?
Well, the first thing we're required to do when they come in is to check the insurance, make sure that it's valid, because sometimes they have expectations that don't match what the state believes. The Arkansas Medicaid, Our Kids A, and Sooner Care do cover orthodontics under certain circumstances. So Medicaid, Sooner Care, Our Kids A, and those three do cover braces. Our Kids B does not have a coverage for it. We determine if they have the proper coverage. Then we do an examination on them, and there's a handicapping score, a fairly complex sheet where we check off different things that are present. There are a number of values applied to that. If they have a certain total of teeth sticking out, depth of overbite, sorry to use my hands, crowding, different elements, they get points for these. One thing that we do very carefully is if they don't have the points necessary, 26 in Arkansas, 30 in Oklahoma, we don't want to give the patients a false anticipation that they might get approved. We don't send them out because we know from 37 years of experience very clearly that if it's anything less than the qualification level, they will not be approved. So our attitude is that we want to be straightforward with the patients and with you as doctors, and we don't send it off unless there's minimum points that are available for approval.
So what are the chances for these patients who have the qualifying points? What is the chances that the state is going to approve them?
Well, in Oklahoma, if they measure up to the 30 points and we send it off, the chances are almost 100% that they'll be approved. In Arkansas, the system is a little more fluid, and if they have 26 points, which we calculate very precisely and very carefully, we have about a 50% approval rating. I can't explain it, but Oklahoma patients, when the paperwork is sent off, can anticipate close to 100%, and Arkansas patients can anticipate about a 50% approval rating.
So a patient doesn't qualify for state aid. What can happen with that patient that doesn't qualify for state aid and can't afford orthodontics?
That's a real good question, because I think this is one of the places that we really bring value to our patients and value to the doctors who care for these patients. We're always disappointed when they don't qualify, but we've learned to expect it from the way the system operates sometimes. What we have is, in our system, is very favorable fees, very comparable if not lower than others, excellent financing, zero down, nothing down, no tricks, zero interest financing, and even payments that are extended a little bit past the time of treatment, which is quite unusual. And so what we're able to do, and we find that a large percentage of the patients that don't get approved or can't even be sent off can navigate their way through these lower payments without interest, without penalties, with no tricks, and a zero down payment. So we think that we provide an option for them that is exceptional, and we can give them real value. If they just can't do it, and it happens all the time, and especially right now when things are difficult, we put them on our 6 months recare system, we bring them back in 6 months, and we find very often within 6 to 12 months they've made adjustments that allow them to engage themselves in our system and get the work done.
And the recare appointments, are those of any fee?
No, there's no charge for those.
Okay.
Thank you.
And the dentists that are observing this interview today, what would you like them to carry away from their time here?
Well, one of the things is that we're serving a lot of patients now, and they know this because we get enormous and very gracious referrals from our general dentist. We just want them to understand that we are not only happy to serve their patient with state-based insurance, but we're equipped to serve them. And as I said earlier, we didn't come to this market lately for financial reasons. We've always had a heart for this market, and we want to continue to serve it. We have excellent ability and very high approval ratings. The patients are blended into the practice, and they're not treated differently or adversely in any way. It's a very blended practice, and I think the final thing I would say is the high value we bring because of our fees and our financing arrangements, which allows people who can't get approved to get it done anyway and do it in a way that's manageable for their budget. So I think we bring value at every turn all the way down the line.
Absolutely. Thank you for your time, Dr. Pickard, and we look forward to serving your needs at Arkansas Orthodontics very soon.